Hi, the purpose of this video is to teach you about the clinical opioid withdrawal scale. This is going to be the scale that I text you to help quantify if you are in opioid withdrawal and ready to start taking Suboxone, which is buprenorphine with naltrexone mixed together. You don't want to take this prematurely because if you do, you will cause yourself to go into withdrawal, which is more uncomfortable. So this scale will help you know exactly when to take it. So this scale is going to help you figure out how often you should take the medication based on my guidance. And the first symptom we're going to look at is your resting pulse. The resting pulse should be measured after you've been sitting or lying down for 1 minute, not doing some activity pacing the room. You sit for 1 minute and then you check your pulse. You can use a pulse oximeter, Apple Watch, feel the radial pulse, or some other way to check the pulse. But you want to measure for a whole minute how many beats do you get. And if your score is less than or equal to 80, that's 0. 81 to 100 gives you 1 point, 101 to 122 points, and you can just tick them off as you go through your list. The next symptom, sweating, not accounted for by the room temperature. So if it's 90 degrees in the room, that's the reason to sweat. We wouldn't count that. But you want to know comfortably situated room, anywhere between 65 and 70 degrees, depending on your preference, in the room for about a half hour. Ideally, the room you would sleep in and relax in. And we're looking to see, does it look like you're sweating? Does the person complain of chills? Do they feel like they're really hot? Can you see it on their face? Is it on their brow? Is it just, are the beads of sweat just dripping from the face? Then you would assign the appropriate score there. Oftentimes it's just subjective. Now, of course, you can report something that's not observable, and that would give you more points, but you try to be as honest and accurate as you can, because if your withdrawal is truly not as severe as you're reporting it, like I said, you may prematurely take the medicine and cause yourself more symptoms. So really be as honest as you can in the reporting of symptoms. Restlessness, able to sit still, difficulty sitting still. If someone observes you shifting and moving constantly, or you're unable to sit still for more than a few seconds, that would be the symptom to report. Pupil size, likewise, the brightly lit room or a flashlight shining in the eye should cause the pupil to shrink. That's normal. It's trying to let less light in. But if you're in a normally lit room where you can read, then we're looking at the pupils. If they're normal size and you can read, then 0. But if they're a little larger, or you feel like the light is too much, but ordinarily this would be an adequately lit room for you, then the pupil will get larger, and that's a sign of withdrawal. And the wider the pupil, the more withdrawal. And so you can see the score can greatly be affected there. Now, this next symptom for bone or joint aches, this has to be a new pain, not the pain that the opioid was originally intended for, but a new pain, usually of the thighs or arms, abdomen. Could be mild achiness, little stiffness, difficulty moving around, or outright you're trying to massage your thighs and arms and belly to just try and feel better. And that would be the score you're noticing there. But again, new pain, not the pain that you took the opioid for. Runny nose, you can't account for this with cold and allergy symptoms. So if you're having cold and allergy symptoms, we're going to have to cut the score out, or you take your cold and allergy medicine that normally works, and then we see what the score is at that point. But stuffiness and runny nose or tears, these can affect the score as well. And then finally, GI upset. Here you go, over a half hour. So you can't just have a transient cramp. The cramp, all these symptoms should be persistent for at least a half hour. If the symptom comes and goes, we wouldn't count it. But if it's persistent for a half hour, then you can assign the appropriate score here. And then you can look at tremor. So if I don't see a tremor on the person, they get a 0. But if the person tells me they think they're having a tremor, but I can't see it, then they get a +1. If I can observe that I clearly see you're having a tremor, you get a +2. And if it looks like you have restless leg syndrome, but you're wide awake, that level of tremor, then that would be a +4. And then yawning. Do I observe you yawning in the time it takes me to do this assessment? So how many yawns are you having? Up to 2 yawns, you get 1 point. 3 or more yawns, you get 2 points. More than 3 yawns, you get 4 points. anxiety. If I don't see you anxious, you get a 0. But if you tell me you're feeling increasingly irritable and anxious, you get a 1. If it looks obvious to me that you're irritable and anxious, you get a +2. If I observe you to be so irritable and anxious and pacing and unable to get situated, then you get a +4. Goose flesh, that's goosebumps. We also call that piloerection, and that can be either smooth skin, or if I run my hand on the person's skin and I can feel it, they get +3. If I can see it and I don't need to feel it, they get a +5. And what you want is a score of at least 10. More than 10 is preferred. So if you're greater than 10, so 11, 12, that kind of thing, then we're going to give you the first dose of Suboxone. And then what's going to happen is we're going to reevaluate you in 2 hours. And if in 2 hours you're still having a score of greater than 10, then I'm going to double your dose. So if you got 2 milligrams first, then in 2 hours, you're going to get 4 milligrams if it's greater than 10. If it's less than 10, you don't get anything, but if it's greater than 10, you do. 2 hours later, I'm going to check again, same symptom checklist. If your score is still greater than 10, then I will give you 8 milligrams. We're doubling the dose every 2 hours. Check again in 2 hours. If your score is still more than 10, then we will increase the dose again. But you should be in contact with me as we're doing this. Do not take the next dose until you've sent me your results, because I will guide you. I may offer you other meds that are supportive in addition to this. The next day, as you go through this, we don't need to do this scale anymore. What will happen is we will then give you the appropriate day-long dose the next morning. What's happening is the Suboxone is compounding in your system, and so you will have enough medication, and the half-life is sufficiently long that it will gradually taper out and thereby reducing these symptoms. You can stay on the supportive medications beyond the 3 days, and these symptoms will start to go down, and you will hopefully no longer be in withdrawal, or it'll be very mild, and things like Pepsid and magnesium, maybe some gabapentin will be helpful in reducing the symptoms you're feeling. And then we will give you a final dose on day 3, and that will gradually wash out of your system as it is compounded, and then you will continue with the supportive meds and then follow up with your treating provider within a week.